this one we hear all the time. You as a surgeon, you've dealt with really hard patients before, really hard eyeballs. Probably some of the most notoriously difficult eyeballs are ones that have had RK. Can you talk about RK patients? Can you explain what RK is, first of all, and then talk about why this is a or is not a good option?
So 25, almost 30 years ago, was just the beginning of the revolution in corrective eye surgery. The ability to have someone who was nearsighted be adjusted in a way that gives them good normal distance vision. It was called radial keratotomy. It was a procedure that was actually imported from Russia and refined and made much better in the United States. And it was the first step towards being able to recontour the front of the eye in a way that provided neutralization of the refractive error. Now, we got better at it. We decided that, okay, this works really well, but we can do the same thing with a laser and even more accurately. And that's when LASIK came into play. And this has been over 20 years now that LASIK has supplanted radial keratotomy, but many patients did have RK to begin with. And of course, literally millions of patients have had LASIK. And so what that does is it recontours the shape of the cornea. But what it doesn't do is it doesn't eliminate time. I mean, every year we're a year older and, gray hair, wrinkles, and cataracts. And if you had radial keratotomy when you were 45, 30 years ago, the math is against you. You will develop cataracts and there'll be a shift in your prescription. But what it also means is that the shape of your cornea, the shape of the clear part of the front of the eye, has been altered. And our nomograms, the things that we use to predict lens power, are really all situated and they're all designed for corneas that have not had that alteration. Plus, the alterations will have nuanced differences in where the effective power is. And what it does is it just creates, as a long-winded way of saying, it creates uncertainty in the selection of an implant, meaning that we'll do our best math, but at the end of the day, we can't be confident we're going to have exactly what we want or what we intended because the cornea isn't necessarily predictable in how it acts. That's where the adjustable implant, the light adjustable implant, it's a game changer. We don't have to have, it's not like one shot and you're done. Now we can get close, but we can also then adjust and fine tune in a situation where we weren't able to be as accurate because of pre-existing previous corneal surgery. We can now do a great job. And the same is true with LASIK, that we now have the ability to fine tune. And so it just completely changes the conversation and the expectation for someone who understood and had clear vision without glasses because they had RK 30 years ago or they had LASIK 25 years ago. And they really know the personal quality of life value for that, which is real. But now it's slipped away. Well, it didn't wear off. The LASIK didn't stop working. They develop cataracts, and that is where the treatment now needs to be centered. And now we know we can do the same thing. We can do a premium cataract operation. We can do a custom procedure, and that custom procedure comes with expectations, obviously, quality of life considerations, but it's also high tech, high touch, and it's a journey that we take with the patient, and it costs more. I mean that's the reality of it. It's a personal judgment that people will make and say, all right, well, what is it worth to me to have that quality of vision? And if it's within the realm of possibility, is it something nice I can do for myself that I'll enjoy? And it's durable. So, again, a long-winded discussion or maybe concept of corneal stability and refractive error correction. But the light adjustable lens, boy, it just is a game changer.
Yeah. That's the easiest conversation I think for me to have when I have somebody who's had RK and they're considering upgrade options. You can always do the standard. You can always do the traditional lens. That is always on the table. The expectation there, though, again, is probably glasses. We'll do our best to keep you as low of a prescription as possible. But the reality, especially with RK, expect glasses for both distance and for reading. I tell patients all the time, just expect to get a bifocal or a progressive lens after. And if we don't end up that way, that means our math perfectly worked out. Great, but it doesn't always happen that way. RK is it is difficult. It is a challenge that we have to deal with surgically, you do, and then me post-operatively. But the light adjustable lens really is a no-brainer in those patients. I mean, when I see somebody who's had RK, I always talk to them, hey, this is the best option for you. Because what can happen with RK is the cornea can be a little bit unstable. As you heal, that healing process, that's the big variable in our math problem here. We usually do have to extend that out a little bit. So for the average individual, we do our light treatments starting at about 3 weeks. And that's when the average person with a cornea that hasn't been touched before is pretty refractively stable. And then we can start making our putts, right? For RK, we have to push that out. We don't start the adjustments for at least 4 to 5 weeks, and oftentimes I'll bring them back several times to make sure that they have stability. Just like putting, you got to make sure that ball comes to a rest. You can't putt the ball while it's still moving. If the cornea is still shifting, if it's still not perfectly stable, I only get 3 shots. We only have 3 shots to make an adjustment. We want to make sure that we're getting repeatable data points. And it does mean that the process does extend out a little bit. So on average for those individuals, it's probably 2 to 3 months, give or take. But they tend to be the happiest ones. All of our patients with the light adjustable lens, not all of them, but most of them tend to be very, very happy. The RK patients understand what that fluctuation tends to be because they've had that procedure done and they really shine with this. The other part that RK patients really do well on is that the cornea almost acts like a multifocal contact. So if anybody in the audience has had multifocal contacts, the way those work is optically splitting light. So your cornea has, in essence, with RK, it's kind of splitting light a little bit and it provides an element of depth of focus. So you can have really good distance vision and actually some reading ability too without any sort of compromise. So it does work fairly well. So for those patients, especially those with RK, I mean, would you ever do a multifocal or a depth of focus lens, Dr. Vukic?
There's no way. There's no way. If you did that, there would be a very high potential chance that this patient would be unhappy. I mean, you can't do that with the same level of confidence. And so I would not recommend that. A good way to take care of the conversation and take care of patients is what would I do for my wife? What would I do for my children or myself? And the answer needs to be consistent. And what would I do for myself if I had had RK? I would never use a multifocal. I would only consider using a light adjustable lens. And so the advice that we give always should be applicable. Turn it around and say, what would you do with your vision? And you can't go wrong. That is simply it's just the level of experience that we have and the opportunity to understand the nuanced decisions of how to get the best quality of vision isn't something we could expect patients to make that decision. They don't want to be an optical expert.
Mhm.
They want to get advice, not confusion. And so that, from a professional standpoint, is I want to know what's the best, and just give that to me as a recommendation.
Yeah, the upside is clearly the precision. The downside is the time. And
Yeah,
when we started doing this, 5 years ago, I
yeah,
remember thinking that people weren't going to like the amount of time
yeah.
that it took, right? On average, it's 6 to 8 weeks for for a normal case. I find that people really don't mind the time. And in fact, a lot of people want to extend that time out because it's like test driving your car for a couple extra weeks. Wouldn't it be nice to just, yeah, I'm taking the car up to the mountains for the weekend. Maybe can I test drive it before I commit to it, make sure it handles well in the snow, make sure it handles well in certain conditions. That is literally what you're doing when you're going through this adjustment process. You are literally test driving your vision in different scenarios. We started doing this our first couple of months doing it. I think we were doing adjustments on Monday and Thursday. So we had 3 days in between each adjustment. And we found that, that wasn't enough time. I got the comment on the question all the time. I'm going up to the lake or I'm going golfing this week and I don't really want to make a decision on my next appointment because I haven't done those activities and that's what I like to do. So we found that 3 weeks was almost not long enough, or 3 days was almost not long enough. And we extended it out to at least a week. And even still, I have patients who want 2 to 3 weeks. That is fine. As long as you're following the instructions, if you've got eye drops that you should be taking, take the eye drops. You should be wearing the UV glasses outdoors. Make sure that you are, you can't move away. That's the big thing. I can't have patients moving away. I mean, because you have to come back. But time is really on our side. And I say our as the patient, as part of that team, on our side, because we're waiting for your visual system to adapt. We're waiting for your eye to continue to heal. And that's no different for RK patients. But multifocal lenses, yeah, I agree with you. I'd be a little bit nervous about putting a multifocal lens in somebody who's had RK. And refractive surgery, you just have to be careful. Even LASIK, specifically hyperopic LASIK patients who were farsighted before LASIK. But that's a different question.